Hello and welcome to my presentation. Today I will be presenting pitted keratolysis and the nature of infection and host response. First, I would like to discuss the chain of infection. Infection is characterized as an invasion of a foreign substance and the proliferation of the pathogen into a vulnerable host. The chain of infection consists of 6 stages, identifying each component of infection. The chain of infection consists of the following. Stage 1. Organism. Organism determines the type of infection that is present, therefore determining the nature of the microorganism as to whether it's a bacteria, virus, parasite, or fungi. Stage 2. Reservoir. The environment in which the microorganism can survive. This includes the host environment and the surrounding environments which the host comes in contact. Stage 3. Portal of exit. The portal of exit is the course in which the microorganism can escape the reservoir. Stage 4. Transmission. Transmission is the pathogen's route of travel from the reservoir to the portal of entry. Modes of transmission can occur directly or indirect. For example, direct transmission occurs via inoculation, by bites or sharp injuries, inhalation of body fluids by the respiratory tract, touching, sexual intercourse, and/or ingestion of body fluids through the gastrointestinal tract. Indirect transmission occurs via infected dressings or tissues with the vulnerable host. Stage 5. Portal of entry. The site or opening that the microorganism enters the body of the host. Entry is found via blood, cuts, and surgical wounds. Stage 6. Vulnerable host. Immunity is what protects its host from pathogens. Therefore, the host's immune status determines its self-advocacy against microorganisms. Thus, infection does not occur with every microorganism that enters the body. Hosts can be vulnerable due to illness or an immunodeficiency. However, vaccinations are the solution to host susceptibility to specific pathogens or viruses. Now to present my case report. A 27-year-old male presented with malodorous craterform pits on the soles of his feet and interdigital spaces. The patient is a personal trainer and wears the same pair of joggers 5 days a week. The patient reported a 5-month history of malodorous and hyperhidrotic feet with no previous history of trauma to the affected area. Pitted keratolysis is caused by the proliferation of bacterial species in moist conditions. These bacteriums include Cornea bacteria, Dermatophilus conglonesis, Chytococcus sedentarius, Actinomyces, and Streptomyces. Pitted keratolysis presents clustered crateriform in the shape of small pits as a result of the stratum corneum horny cells being destroyed by protease enzymes produced via the bacteria. Pitted keratolysis is often presented with malodorous feet due to bacterial infection of the soles. Bacterium such as thiols, sulfides, and thioesters produce sulfur compounds which are causative of foot odor. The patient was given a treatment plan. Instructions included wearing different shoes every second day to allow them to dry out. Also, to keep footwear drier throughout wear, wearing cotton or wool socks are more proficient for sweat absorption. Wearing open-toed or breathable shoes was advised whenever possible to prevent sweating. To minimize sweating further, the patient was instructed to apply antiperspirant to feet twice a week and to wash feet twice daily with soap or antiseptic cleanser. Pitted keratolysis was prevalent despite action of the infection prevention plan. Therefore, topical antibiotics were recommended, such as topical or oral erythromycin, fusidic acid, and benzoyl peroxide. Next, I will discuss the host response. The human body has defense mechanisms in place to control pathogenic colonization on the skin. However, depending on the host's immune status, organisms are able to break through protective barriers of the skin, posing a risk to the host's ecosystem. Once the host's ecosystem is compromised, the host response is to defend itself against the pathogen. Thus, the immune system responds by attacking the foreign substance with antibodies. The defense response can provoke symptoms in the host, such as fevers as a result of temperature changes and a decrease in plasma ion levels. These are defense mechanisms that create an uninhabitable environment for the infection. The host also has inflammatory responses as a mechanism to create more environmental stress, such as heat, swelling, and redness. Host response of pitted keratolysis is associated with the following: crateriform pits, macerated skin, superficial skin erosions, malodorous feet, hyperhidrotic feet, and soreness or itching when weight bearing. Now to identify the reasons and causes of infection. Pitted keratolysis, like most bacterial infections, are easily contracted. However, those most at risk of developing pitted keratolysis include farmers, athletes, sailors or fishermen, industrial workers, and military personnel. Causative factors of pitted keratolysis development include hot, humid environments, wearing occlusive footwear, such as rubber boots or vinyl shoes, having hyperhidrosis of hands or feet, individuals with diabetes, old age, and/or an immunodeficiency. Pitted keratolysis thrives in warm, moist, and dark climates, such as shoes, drain traps, towels, sinks, and showers. Human body temperature combined with the confined and poorly insulated structure of a shoe creates the ideal environment for microorganisms to live. Wearing the same footwear allows bacteria to proliferate within the shoes and socks. Therefore, for hygiene purposes, it is advised not to share socks or towels and alternate between footwear to allow a drying out period to prevent transmission from infected objects onto the skin. Next, I will discuss the microbiology of pitted keratolysis. Pitted keratolysis is a chronic, non-inflammatory bacterial infection with a prevalence that is worldwide. Pitted keratolysis affects all age, race, and sex groups. However, 97% of cases are adult men with sweaty feet and fewer affecting the elderly and women. Pitted keratolysis is caused by a cutaneous infection with organisms Keratococcus sedentarius, Dermatophilus conglomerasis, and the Corynebacterium species. This triad destroys the stratum corneum by creating pits in superficial skin. The organism K. sedentarius is related to the gram-positive Staphylococcus bacterium, which thrives in tryptase soy agar environments and produces two keratin-degrading enzymes, protease P1 and P2. D. conglomerasis and the Corynebacterium species are an aerobic gram-positive bacillus. However, the Corynebacterium are also catalyse positive. Differential diagnosis is commonly tinea pedis and plantar warts. In conclusion, the patient presented signs and symptoms of crateriform pits located on the soles and interdigital spaces of feet, accompanied with hyperhidrotic and malodorous feet. The patient lifestyle, such as wearing the same sweaty joggers consecutively 5 days a week, was an indication of the patient's malodorous feet, and the warm and wetness of his footwear presented as a high microbial environment and the source of the bacterial infection. The patient was educated on ways to prevent sweating and maintaining a healthy environment in his footwear, which included wearing cotton or wool socks to absorb moisture and alternate between two pairs of footwear to allow them to dry in between uses for infection prevention. To assist in treating the bacterial infection, the patient was given a referral to their GP for a prescription of the topical antibiotic erythromycin. The patient was advised to see their podiatrist in 3 to 4 weeks for a follow-up appointment to review the progress of the antibiotic, on the bacterial infection sites of his feet. Overall, pitted keratolysis has a favorable prognosis. Thank you for listening.